For this podcast, we are going to talk about how noise impacts the welfare of dogs in a shelter situation, how to recognize the signs, and also some possible treatment options. Our expert on this topic is Dr. Sara Bennett. She is the owner of Veterinarian Behavior Consultations, and she also consults with many shelters in the Chicago area. So before we get started, Dr. Bennett, could you tell us how you became interested in behavior medicine, and particularly how you became interested in behavior medicine as it applies to dogs and cats in the shelter situation?
Thanks very much for having me. I am a veterinarian by trade, so I went through vet school. Didn't really have much of an interest in behavior at that point. Started to go into some courses and learned more about it, and also addressing my own dog's behavior problems piqued my interest. Got into general practice and decided I wanted to specialize in behavior, and was lucky enough to be taken into a residency program that was actually funded through our shelter medicine program, and that is where I first exposed to shelter medicine and consequently fell in love with it. And so one of the areas where I focus is animal behavior, but specifically within the pets who are in sheltering situations.
Thank you for that. So moving on to today's topics, Dr. Bennett, could you please define noise aversion?
So noise aversion is a term that we use to describe fear, anxiety, or even a phobic response that a dog may experience or display when they're exposed to some type of noise trigger. Most people are going to think about things like thunder, fireworks, gunshots as the most common noises, but honestly, it can be any noise in the environment that dog could perceive as frightening and therefore would respond to it. So we really have to broaden our horizons a little bit and think about all of the noises during a daily event that could potentially worry a dog.
And what are some of the signs of noise aversion?
So we're going to look for those signs that indicate the dog is fearful or stressed or anxious. So trembling, being hypervigilant with that wide darting gaze, startling hard, particularly when a noise occurs. You can watch the dog and someone drops a bowl and the dog really reacts heavily to that. You can also see the more subtle signs of fear, such as lip licking, yawning, the darting gaze, pacing back and forth, or sometimes this can be a component of even abnormal repetitive behaviors that we see in a shelter. And remember, these dogs that are showing anxiety and fear, these are the ones that their welfare is compromised, and they're telling us this by their behavior, and they're the ones that are going to benefit from treatment.
So dogs with noise aversion can exhibit a variety of signs. Turning to the shelter, if we think about the shelter, we think about the dogs in the shelter, we think about the different noises in the shelter. How do those noises actually impact dogs that are living in a shelter situation?
So if you're thinking about a sheltering situation for a dog, remember that any noise could potentially be threatening or frightening to that dog. And so we have to take a step back and look at the sheltering environment itself and look at what types of noises occur. A lot of times it's noises that we get used to and we don't really pay that much attention to, but things like barking, loud voices, moving of equipment during cleaning, opening and closing cage or kennel doors. Those metal doors can be really, really loud. Those types of things can really, really stress out a dog. And if you think about it from the dog's point of view, remember they're coming into a shelter and the environment's completely foreign to them. And so even the most well-resourced shelter is still going to be inherently stressful to a dog. You compound that by adding all of these additional noises to it, you can have a dog who becomes profoundly anxious and fearful, and his welfare is really suffering.
So are there certain times during the day where the noises may be more prominent or have more effect on the dogs?
There can be. There are certain times during the day where we're more likely to have a higher volume of noises going on, and particularly barking. We're going to have increased barking initially when staff come in because they're interested in social interaction. Feeding time is going to happen soon after that, and so the dogs will bark in anticipation of feeding time. Those times that we're working on cleaning the kennels, or even when the shelter first opens to the public for adoption hours, or you've got specific busy times during the day where you're more likely to have foot traffic, you're more likely to have additional noise at those times as well. So every shelter is going to be a little bit different, but those are common times where we're going to have increased noise.
Once you've identified that a dog is having a problem with the noise, they have noise aversion, they're showing those signs of fear and anxiety, what are the next steps as far as trying to help that dog through that situation? How do you go about treating those dogs?
So if possible, we use all of the resources available to us in order to put a treatment plan together for that dog. And this might include environmental management, like moving the dog to a quieter area if we have the opportunity to, giving the dog somewhere to hide. Sometimes that's as simple as covering up part of the front of the kennel or giving them a crate inside the space where they are so that they can try to get away if they want to. But realistically, often at that moment, there may not be a whole lot that we can do. We can't necessarily redesign the shelter at that point. We do what we can, but sometimes it's not enough. Then we start thinking about what other options we can include in our treatment plan. And medications is one of those. We have Sileo, which is dexmedetomidine oromucosal gel, as a treatment for noise aversion. And so this may be something that we could consider using for those dogs as part of our treatment plan when we can't do enough with our environmental management.
Dr. Bennett, you mentioned Sileo, dexmedetomidine oromucosal gel, as one of your treatment options for dogs that have noise aversion. So can you explain how you would identify a dog that would benefit from Sileo and put into a little bit more detail what that would look like?
So I think this is a really versatile treatment option for us when we can identify that noise is a part of the problem for that dog. You know, if we have a dog who's come into the shelter with a history of noise aversion, perhaps that's one of the reasons that the dog was relinquished, and we know that this is a treatment that works for this dog, we could potentially remove that barrier for adoption. Of course, we have to give full disclosure of the problem, but we can also advise the owner that we've tried this and it's been helpful to manage this problem. So we're setting up the owner and the dog for success for this expected problem, and the adoption and bonding process can be a smoother and more successful transition.
Do you have an example of a dog where Sileo was used to help them overcome their noise aversion?
Yes, actually, I have a golden retriever, ironically named Wrigley, appropriate for the Chicago area. She actually came into the rescue group because of her noise aversion. It was something that her former owners were not able to manage. So while she was in her foster home, we were able to do medication trials for her, as well as setting up the rest of her treatment plan with environmental management and things like that. And she actually responded very beautifully to the Sileo, and this was something that we were able to use when advertising essentially for her. It's like, hey, we know that she's really got a problem with loud noises, but we've worked on treating this, and so now we have a manageable problem when previously it was one that was a huge barrier for her to be able to stay in a home. And she was adopted. She's still in that home now, doing pretty well.
Well, good for Wrigley. I'm glad that she has found a home and is very happy at that home and is adjusting well to that home. So, Dr. Bennett, are there other situations in the shelter where you think that Sileo would be appropriate to help dogs that are having issues with noise?
So this is something that I would reach for when I think that there's a component of noise with the anxiety and stress the pet is experiencing, particularly if it's one that is so stressed that he's not wanting to eat. So example, two shelter dogs we saw, Clint and Cletus, had come in from a stressful environment to begin with, but they were very overwhelmed by this shelter. And they would come up to us and let us touch them, but they would not eat. And we didn't want to force a pill down their throat and increase their stress. But we could handle their mouth enough that we could, give something like the Sileo. And remember, this is something that can be given oral mucosally. So ideally, we give it before the noises begin. In this situation, of course, the noises were already present and they were stressed. But you can redose it if it's needed. So, for example, if it's really stressed at feeding times, that would be a good time to dose.
You've identified a few ways where Sileo could be used to help dogs that have noise aversion in the shelter. Either they come in with noise aversion or they develop issues with noise once they've been in the shelter. Once you've actually identified that a dog has noise aversion, what are your recommendations for using Sileo to help those dogs?
In terms of using it as a treatment plan, I recommend using this 3 days in a row to see if it helps the dog. And we monitor that by watching the behavior signs and whether or not those are increasing or decreasing. Hopefully they're decreasing, and if so, then we'll continue to treat them. And if not, we'll look for other reasons that the dog's behavior is indicating that he's still stressed and modify our treatment plan based on that.
So you mentioned that you used Sileo because you weren't able to get other medications into Clint and Cletus. Can you tell us how Sileo is different than other medications?
It's a gel formulation, and it's in a preloaded syringe. The syringe has a blunt tip. We don't need a needle to do this. And it's slid into the mouth between the cheek and the outside of the teeth. Then we depress the plunger, and that gives that measured amount of the gel into that little pocket there. And it sits there and is absorbed through the gum tissue at that site so that we can have the amount of medication that we need absorbed and made available to the brain to help reduce those stress, fear, and anxiety signs.
Now, I did want to ask you about dexmedetomidine, which is the active ingredient in Sileo. We know that it's used in the clinic as a sedative. It's given as an injection. And I was wondering if you're seeing a similar effect from Sileo. In other words, are you seeing any sedative effects as a result of administering Sileo?
We're really generally not. And that's one of the nice things about Sileo is that it is a tool to help reduce anxiety, but we generally are not seeing sedation. These doses that are bioavailable are low enough that we're able to take advantage of that anti-anxiety point without overdoing it to the point where we see sedation, which typically is going to happen at the higher doses. So what we're seeing with the dogs is that they are still alert and interested in what's going on around them, but their body language is showing that their emotional state has changed. They're less anxious, they're less fearful, they're less stressed, being more relaxed and willing to have a social interaction. And those are some of the things that adopters are looking for when they're picking out their new companion. So this can be a really helpful tool to let the dog show his best side, if you will, to help reduce the anxiety so that they can be who they really are, even in that stressful environment.
So basically what you're seeing with Sileo is that the dogs are calm, but they're not sedated. One thing I do want to circle back to is you had mentioned something about the bioavailable dose. Could you explain what you mean by bioavailability?
So with bioavailability, what I mean is how much of the medication that is administered to the pet actually gets to the target area that we're trying to treat. And in this case, it's the brain. Think about the different routes that we can give a medication. You can give it orally, and this medication in particular is going to get broken down by the organs that digest our food. So not much of the medication is going to actually be available in the body to get to the brain. If you think about giving this same medication, the dexmedetomidine, by injection, we bypass all of that, and so there's much more of the medication available to have its activity at the brain. So by using this alternate route, this oral transmucosal route, we're actually kind of going a little bit in between those two, so we have maybe a quarter or so of what we give to the pet will actually be active in the brain than what we would give by injection, but that's still more that we're going to have if we gave it by mouth and had the dog swallow it. So that's what we're talking about with the term bioavailability.
So that was a great explanation of bioavailability. Next, what I'd like to talk about is how you actually give Sileo to the dogs. We know that the syringe is a novel mechanism of delivery, and we know that the route of administration is different. You're giving it between the cheek and the gums. You're not giving Sileo for dogs to swallow. So when you are giving instructions to the folks in the shelter before they're giving Sileo to the dogs, what are some of the things that you like to highlight to ensure proper administration?
So when we're administering Sileo, we want to make sure that we're wearing gloves because we are using a gel. We check the dog's weight and use the dosing chart that's provided to make sure we have the correct dose, and this is usually pretty straightforward. We then dial the green ring, which is the ring stop, to the right position based on the dot dosing and lock it. And it's really important to remember to lock it so that it doesn't slide when you administer the gel. And we give this in between the cheek and the gums so it can be absorbed through the oral mucosa. If the dose is greater than 6 dots, say we have a large dog, we might split the dose. We do half on one side of the mouth and half on the other side. And sometimes in those really small dogs that can be helpful also. And remember, if Sileo is swallowed, it's not going to be effective because it's going to be immediately metabolized, so it's important for it to have contact time with the gum tissue in order to be absorbed.
Those extra tips on how to administer Sileo are very helpful. Next, I'd like to talk about our patients that may not be good candidates for Sileo. So, we've talked quite a bit about why you would give Sileo, when you would give Sileo, and how to actually administer Sileo. But I was wondering, are there specific patients that you would not consider using Sileo as a treatment for noise aversion?
There are some dogs that I would choose not to use Sileo in. Those cases where you wouldn't use any dexmedetomidine preparation in. Those with a severe heart condition, severe respiratory disease, significant liver or kidney disease, serious illness or compromise. We don't use it in dogs that are lactating or pregnant, or puppies that are less than 16 weeks of age. And I also wouldn't use Sileo in a dog who's had it previously and had an adverse reaction.
Are there any side effects that people should know about?
Occasionally we'll see the gums at the application site lose their color, so they blanch a little bit due to vasoconstriction. This can be a little alarming to the pet owner or the person handling the dog, so we tell them about this first. Rarely we've seen some dogs be a little bit more sedate or drowsy or even perhaps vomit, but we make sure that the person who's administering the Sileo has been trained on how to administer it appropriately, making sure that the ring stop is locked, there's no overdosing, and we tell them what to expect and what to worry about.
Well, Dr. Bennett, thank you so much for your time today. You've given us some really great information about noise aversion in the shelter and ways that we can treat this condition. Before we let you go, are there any final thoughts that you'd like to leave us with?
Well, first you want to make sure that you've read the instructions. There's a lot of great resources available on how to administer it. There's videos available that demonstrate how to do this. Again, ideally, we can give the Sileo 30 to 60 minutes before an anticipated noisy time, so feeding or high traffic adoption foot traffic. But we can also give it, at the time when the dog starts to show that anxiety. We want to make sure we give it between the cheek and the gums so that it can have that mucosal contact. And remember, this can be best used as a short-term treatment environment to facilitate transition into the shelter when we can identify that noise is a problem for that dog. So we help them acclimate to the environment and transition them into the home. And remember, don't forget about those other noises. There's more noises out there other than just gunshots, fireworks, and it's not just those big ones. It's all of the daily noises that can compound upon each other and stress that dog out.
That concludes our podcast today about recognizing, diagnosing, and treating dogs with noise aversion in the shelter situation. If you'd like to learn more about Sileo, you can go to our website, SileoDBMUS.com. To see the full Sileo prescribing information, go to zoetis.us.com/SileoPI.